I have the pleasure of introducing the next speaker. It's Dr. Rebekah Bullard, kick-ass American, coming all the way from there. She has a dynamic poster, so please look at the poster as well. Yes, she has interesting data and is very inspiring. And thank you for coming in person. This is incredible. So Dr. Rebekah Bullard has experience with in vitro and vivo based tick feeding and tick-borne pathogens, including Ehrlichia, Rickettsia, Borrelia, Bartonella, and Anaplasma. She's currently working with Dr. Monica Embers at Tulane National Primate Research Center in New Orleans as a research scientist. Her current research focuses on the development of Borrelia, theranostics, and examination of tick-borne pathogens co-infection dynamics. She is pursuing collaborations for additional vectors and vector-transmitted co-infections. And please welcome her in her talk of dynamics of Borrelia and Bartonella co-infection, evidence of tick-transmitted Bartonella.
Good morning, and thank you for that introduction. So today we're going to discuss a little bit about the dynamics of how co-infection with Borrelia and Bartonella changes the Bartonella infections, and also give some evidence directly to the ability of ticks to transmit Bartonella henselae. So first, I just want to make sure that everyone knows that the authors and scientists involved in this work do not have any conflicts of interest. And for the learning directives for today, I really kind of fit under 3 objectives. The importance of co-infections, some controversial topics, which may not be controversial in this particular audience, but definitely are in some others, and informed clinical care. So the first would be that co-infections of Bartonella and Borrelia can result in more severe pathologies. Bartonella henselae is capable of being acquired and transmitted by Ixodes scapularis ticks, and that Bartonella infection may require at least some level of immune suppression in order to colonize a robust infection in mouse tissues. So just a bit of a brief introduction into what is Bartonella and Bartonellosis. So Bartonellosis would be a collection of diseases that are caused by the pathogen, multiple pathogen species of Bartonella. And those can be self-limiting from things of fever of unknown origin, or just lymphadenopathy, or they could also be more severe, such as the bacillary angiomatosis, where you have growths on your skin or on your liver, as well as neuropathies, such as pain in your hands and your feet, and neurological symptoms such as hallucinations, headaches, anxiety, memory loss, and cognitive dysfunction. But those are only really the things that you can diagnose in clinic. A lot of patients that are infected with Bartonella express a lot more vague symptoms as well. So this is an image put together by a colleague. So this was kind of an informal survey done by Global Lyme Alliance. And this is just kind of a review of what some of the answers that were given as to what their symptoms were and what they considered to be the biggest hindrance to their life. And the main thing was foot pain, which is something a lot of people with Bartonella experience. We also have brain fog and fatigue, and anxiety, and those things are often attributed to any other number of conditions. Also are typically dismissed in clinic. Oh, well, of course you are brain fog, you haven't been sleeping. They're easily dismissed by clinicians. And one of the reasons why there is such a wide variety of clinical manifestations is the differences in the ability of where Bartonella can grow. So it has been shown to grow in biofilms on tissues such as cardiac tissues, causing blood culture negative endocarditis. It can also grow in your red blood cells, and as well as in intra and extracellular environments. So it can grow in your red blood cells, it can grow in macrophages, it can grow outside of the cells, it can grow in biofilms. And its ability to kind of move in and out of all of these environments is one of the leading factors as to why there is so many clinical manifestations, as well as why it's so difficult to treat. Another problem would be that we don't have a great animal model. So there have been a wide variety of mouse strains that have been used, including immunocompromised strains such as SCID, as well as inbred and outbred immunocompetent models. Along with that, there's also additional Bartonella species that have been studied. Some of these are natural infectors of mice. And so it's easy to infect the mice. It's easy to have that long-term bacteremia, but it's not a good model for disease or immunological analysis because the mice just don't elicit that kind of response. Another issue would be testing methodology. So, excuse me, the way that we are able to test in clinic is typically through serology. You also have PCR or cultures, but what each individual clinician chooses to use as its diagnostic method is different. And so there's no one particular method that each clinician uses, and that speaks the same for research. Also in the research, the types of tissue that are being examined also differs. And while the clinically relevant ones are almost always included, such as the heart, spleen, and liver, there are also others. We know that Bartonella persists throughout the body. So there may be organs that are not pathologically affected, where the Bartonella may be residing. Bartonella is a vector-transmitted disease, and in the US, Bartonella henselae, which is the causative agent of cat scratch disease, is considered to be the dominant species in the US. This is typically transmitted through cats, so cats would be the natural reservoir. Your cats get infected through bites with fleas, and then you can then become infected either from your cats when they are infected or infested with fleas. Most cats are asymptomatic, so you would never know. But just because they are asymptomatic does not mean that they cannot pass it on to another flea, another cat, or to yourself. In addition to cats and fleas, there are the other Bartonella species have been seen to be transmitted by a wide variety of arthropod and insect vectors, including fleas, lice, mites, sandflies, bedbugs, ticks, even spiders. So the work that I'm focused on is on ticks as a vector. This is going to be pretty much the same for most blood inviting vectors, but not necessarily all of them. So there are 4 major stages to pathogen transmission and vector transmission. The first would be pathogen acquisition. So you have an infected host that has the bacteria residing somewhere throughout their body. As soon as the tick attaches, it begins to form a liquid blood pool underneath the skin of its host, and the pathogen makes its way to that liquid blood pool. We don't know exactly how that happens. Is it an active process? Is it a passive process? That's a whole different story, but some way that pathogen is able to make it to the blood pool. Once it does, it's taken into the vector, in this case, the tick. Once it has made its way inside of the tick gut, it then must find its way through the digestion tract of the tick and find a way to persist through there. It then has to migrate out of the gut into the hemolymph of the tick and interact with the tick immune system, which ticks do have some type of immune system, and must be able to persist through all of those as well. We do know that vector transmission and pathogen transmission is a symbiotic relationship. So the pathogens are able to change protein profiles of their vectors. The vectors are able to change the protein profiles of the pathogen. And so in addition to having to persist throughout the tick, throughout these multiple stages, also has to make sure that it induces a suitable environment for transmission. And then lastly would be transmission back into an uninfected host. So the pathogen must make its way into the salivary glands so that it can then be transmitted back into an unaffected animal. There are other transmission factors or other ways to be transmitted, such as fleas. When you scratch, flea feces gets into the scratch. There are other methods, but most of the blood-feeding arthropods, this is the main method of such. And we know that Bartonella can be found in ticks. So there is a wide variety of epidemiological and surveillance data that has been able to identify Bartonella in ticks that have been collected from the wild. Now, I will be honest, this is probably just like the first 100 citations on PubMed that I went through. So if I have missed your tick species or location of your favorite, let me know. I will add it later. But we can see that there's a wide variety in the types of ticks that can harbor Bartonella, as well as where this is taking place. This also, some of these are specific Bartonella species that they were looking for. Some of them are just kind of genre specific. And so the work that we were trying to do is to find out exactly if ticks were able to transmit this pathogen, as well as determine what the needs are for an animal or for a host to become infected. And so the first thing that we are going to look at is a comparison of an immune competent versus an immune compromised model. So we're going to look at a C3H model, which is immune competent. They have a fully functioning immune system. SCID beige mice do not have any B cells, T cells, or natural killer cells. So they have a very depleted immune system. Once we kind of determine the difference when we're looking at the injection of the pathogens into these animals, then look and see the differences between when it is a single pathogen versus when we have a co-infection, and if that co-infection happens at the same time versus if it happens at separate times. Also looking at how the dynamics change whenever the pathogen is tick transmitted versus needle transmitted. And then it doesn't fit pretty on the chart here, but we will also discuss a little bit at the end about Bartonella acquisition of Ixodes scapularis. So how do we do this? For most of our design is the same. So we have mice that are injected with Borrelia or Bartonella, either on the same day. So this would be for the single and the simultaneous. So this is going to be infected with Bartonella, or at the same time, Bartonella and Borrelia. And then samples are taken every 10 days after that. In the case of sequential infections, we have mice that have been inoculated with either Borrelia or Bartonella, and then 2 weeks later, they are inoculated with the opposite. And then samples are taken every 10 days. For our tick-mediated infections, we capillary feed our ticks, so we essentially force feed them the pathogen in culture media, let those return to kind of a flat, unfed, hungry state, and then we place them on mice to see if they are able to transmit that pathogen. And then again, samples are taken every 10 days. And then lastly, for the tick acquisition, mice were inoculated with Bartonella henselae either 10 days or 1 day prior to the placement of ticks. We were looking to optimize the amount of Bartonella that was in the blood. Ticks were placed. As they fell off, they were collected and tested. And so our results kind of fall into 3 major categories. So we have the immune competent models, the immune compromised models, and the immune suppressed models. So looking at the injection of Bartonella henselae into an immunocompetent C3H mouse, there's not a robust infection. So we have 1 mouse or 2 mice out of 9 that became infected, and only 1 mouse in each of the two groups. And the tissues that were infected, there was only 1 tissue in each of those mice. And so we have the ears at day 30 and the pancreas at day 10. And so there's no real rhyme or reason to what we were doing. Now, this was detected using nested PCR. We have developed, or other labs have developed, and we have started using a more sensitive test So a lot of this is kind of being redone now to see if we can identify it in other tissues, but at this time, this is what we got. But whenever we move into a immune compromised model, we see that the injection of Bartonella henselae results in a much higher infection, which I don't think is a surprise to anyone. Here we have 7 of the 9 mice that are infected and a wide variety of tissues that then become infected. So most affected would be the brain. Here at day 30, where all 3 of the mice had Bartonella present in their brains. And then a variety of other tissues, including the bladder, is also highly represented. We then took ticks and allowed the infected ticks to feed on immunocompromised mice, and we still see that increased amount of pathogenicity. So again, 7 of the 9 mice are infected, as well as there's a little bit of a difference in time. And the difference in the amount of tissues that are infected. So needle inoculation, we had only 1 tissue across, or 1 mouse infected per tissue. Here we have multiple mice that are infected in each tissue, as well as kind of a change in exactly what is being infected. So here the lungs are more highly represented than previously. We also have the bladder and the lymph nodes that have started to appear in these as well. And so when you carry that back into the immunocompetent model, so we're looking kind of at an immunosuppressed model. So we know that tick saliva has a wide variety of proteins, and when the ticks are infected, they're able to induce the tick to create a more suitable environment for transmission. And so they have a localized immunosuppressed or immunocompromised location so that the pathogen is able to take hold a little bit better before it reaches the rest of the host. And we do have a better response with tick-mediated inoculation versus the needle inoculation. And again, a little bit change in which tissues are affected. So previously it was only the ears and the pancreas. Here we have the heart, lungs, and liver, which are going to be very heavily vascularized, as well as the adrenals. For the simultaneous co-infection, so these mice were infected with Borrelia burgdorferi and Bartonella henselae at the same time. And we see kind of a low level of infection across all of the groups. But still not a very robust infection, as there's not a wide variety of tissues that are infected. Some of these mice only have 1 affected tissue. When we move into more of a sequential model, so this particular group was injected with Borrelia burgdorferi, so we essentially gave them Lyme disease, and then 2 weeks later, we inoculated them with Bartonella henselae. And we start to see kind of this cyclic infection that you would typically see with a Bartonella infection, with a kind of a dip here at day 20. And again, the dynamics as to which tissues are infected, as well as when they are affected, has kind of started to change. Here, the liver and the lymph nodes are more highly represented. You also have a much higher, a sooner inoculation of some of these tissues. This particular group is the opposite, okay? So these mice were injected with Bartonella henselae, and then 2 weeks later, they were injected with Borrelia burgdorferi. And interestingly, we see an increase in the number of mice that are infected with Bartonella. So we would have expected that within the 2 weeks, the Bartonella is able to clear from the host, because that's kind of what we saw when we inoculated them the first time, right? We only had 1 at day 10 and 1 in day 30. But that's not what we saw. We have a higher increase in the number of mice that are infected at day 30, as well as a wider variety of tissues that are affected. So even though we tested like a total of 18 tissues out of these mice and still only found it in 2 tissues, it's still residing somewhere. If you have any ideas, we would love to know. Because Because when you're able to induce another kind of immune suppression later on, it is able to reactivate and reemerge back into the host, into other tissues. So this is just kind of a overview of all of that data. So you have the immunocompromised, skid beige, when you have needle inoculation versus vector transmitted inoculation, and then your immune competent C3H with both the single needle inoculation, tick-mediated inoculation, simultaneous, so both of those at the same time, and then Borrelia, then Bartonella, and Bartonella, then Borrelia. That starts to get to be tongue-tied there at some point. But so this is all to show that the immunocompromised model is the best model for Bartonella infection in mice, but not just the immunocompromised. Also, when you combine that with the vector transmitted, you see a much more robust, a much higher incidence of infection. But you also see the same with the C3H, right? So here, with the skin, of course, you have, more than a dozen tissues that are affected. However, if you're looking at co-infection or if you're looking for in a competent model, then it is still possible to have a wide variety of infection. So the findings that we have so far is that the increase of Bartonella or that tick transmission is able to increase the amount of Bartonella, both in the number of mice that are infected and in the tissues that are affected. The impact, which is going to kind of jump ahead a little bit here. So we did try to inoculate the mice with Bartonella and then feed naive, uninfected ticks on them to test the ticks to see if they would pick up the pathogen. And those were the most negative PCR gels you've ever seen. So we do know that it is possible, right? So we have the epidemiological and the surveillance data that says this is happening in nature, but it is not happening in the lab. So there is some type of specific need that we're not able to replicate or we're not able to identify exactly at this time. But we do know that it is happening. So again, if you have any ideas on when to do that, because we tested in skid mice, so it should have been high bacterial load. We tested at day 10 and at day 1, so should have had the highest levels of bacteremia. I don't know, we'll find out. So the conclusions is that compromised or suppressed mice are more susceptible and that the vector-based infections do alter the prevalence, the timing, and the localization of the infection. Now, as to how we need to incorporate this moving forward, for scientists, I think it's important that we remember when we're designing our experiments and designing, looking at the data, that the method of infection, the method of detection, and your timing can play a large factor in where you're able to identify the pathogen. And even if you're able to identify the pathogen, for your clinical practitioners, patients don't necessarily need to be immune suppressed for a long period of time in order to become infected. Even just a transient immune suppression, you have the flu this week, and you were bitten by a tick or a flea that has these pathogens. They're still at risk at developing symptomatic Bartonellosis. And then for the patients and the people who take care of these patients, Bartonellosis can present in a wide variety of ways. And the development of chronic conditions does not necessarily mean that you had to have symptoms in the acute stage. So we have plenty of mice in this particular study that we were not able to detect Bartonella at 10 days after inoculation, but we were able to detect it 30 days after. So it is possible that you not have an acute response, but you do have a chronic response. I would like to acknowledge all of the members of our lab and those that have helped me with this work, most specifically Mercedes Cheslock. A lot of this was her dissertation work. Emily Olson has also helped with a wide variety of these things. Stephen Alexander Cohen Foundation is who funded the majority of this work. Please do not use these QR codes. I may be smart enough to science, but I am not smart enough to count the number of days on the calendar, and they have already expired. But this is the email address and websites for any of for all of the contact information, and I will gladly take any questions that you may have.
Thank you for that incredible presentation. It was really informative. But I'm just curious to see what inflammatory markers are you actually looking for? And you see, I know they're immunocompromised, but
so at this point in time, we have not done any of the immunological side. And we haven't really even done the serology necessarily. So we have looked at the pathology in these mice, or histopathology rather, and seen if the tissues are more or less affected. And we are able to identify a few differences there. We're not fully finished with that analysis yet. Serology will be next. The immunological factors maybe upcoming, I don't know. That's Dr. Amber's question.
so is it immunochemistry that we're using?
No, so it's just tissues stained with regular H&E stain, and then observed by a clinical or laboratory pathologist.
So you're on the road.
We're working on it.
Question.
Mhm.
I don't know how to clinically observe mice behavior after they've been infected with Bartonella, but did you have any tracking of like their feeding patterns, anything like that? Because in children, when they're infected with Bartonella, often affects their gut, that's residing and hiding in the gut. But the same token, so you were asking the audience, where can it be hiding? Probably in the gut.
Right.
So have you observed their feeding pattern?
Not directly, and not in a quantitative manner. So they are observed daily through the veterinary medicine department that we have. And they've always been noted to be feeding and drinking well. So we haven't noticed anything directly, but that is definitely an option and probably something that we should look into, yeah.
So, sorry, Rebekah, one to that. But it's a bit unclear if it's a question or a comment, but Bartonella have been found in Australian ticks and fleas. That's the first one.
Mhm.
And then Bartonella, Borrelia persist in biofilms, morph to resistant forms, and could well persist into the axon sheet.
Resistance to
Into the axon sheet.
Yeah, so in the tissues, it definitely does form kind of that biofilm nature, and it is much more difficult to treat. Kind of as Dr. Olson's poster yesterday presented. She also has some biofilm data on that. But as for how well that plays into the diagnostics or into the treatment, that's not my area of expertise in lab. So.